you're sitting in the exam room, the nurse just took your blood pressure, and your doctor glances at the chart and says 146/88.
And here's what almost everyone does in that moment. You zero in on that second number, 88. You think, okay, that's not too far off. I'm probably fine. I need to stop you right there, because that one assumption, the idea that the bottom number is the one to watch, is quietly responsible for more strokes, more heart attacks, and more hospital admissions in people over 50 than almost any other misunderstanding in medicine. I've spent close to 2 decades treating patients with heart disease, and I can tell you exactly what happens next if that belief goes unchallenged. The top number keeps climbing, year after year, while everyone in the room, the patient, sometimes even a rushed doctor, stays focused on the number that matters less. So today, I'm going to show you 3 things. First, which number actually predicts your risk of stroke and heart attack after 50? And it's not the one you've been told to watch your whole life. Second, why your arteries change with age in a way that flips the entire rulebook. And third, exactly what you can do this week, starting today, to bring that number down without waiting for a crisis to force your hand. Stick with me for the next few minutes, because this is one of those things that once you understand it, you'll never look at a blood pressure reading the same way again. Here's the thing nobody tells you. Blood pressure isn't one condition. It's actually 2 different conditions wearing the same coat. When you're 30, 35, maybe even 40, your arteries are elastic. They stretch when blood surges through, and they spring back. In that stage of life, the bottom number, diastolic, really is a meaningful signal because it reflects how much resting tension is sitting in a still flexible system. But somewhere around your 50s and 60s, something changes structurally inside your blood vessels. Not because you did anything wrong, not because of one bad decade of eating. It's simply what happens to tissue over time. The same way a rubber band left in a drawer for 20 years doesn't snap back the way a new one does. And when that shift happens, the number that used to matter less becomes the number that matters most. Let me say that a different way, because I want it to stick. The same blood pressure reading that was a minor footnote at 40 can be a 5-alarm fire at 65. Same 2 numbers on the same little screen. Completely different meaning, depending on the age of the person sitting in that chair. That's the reframe. Now, let's break down exactly what these 2 numbers are actually measuring. Because once you see it clearly, the rest of this will make complete sense. Picture your heart as a pump, because that's literally what it is. Every time it beats, it squeezes hard and shoves a wave of blood out into your arteries. That moment of maximum squeeze is your systolic pressure. It's the top number. Then, between beats, your heart relaxes for a split second and refills. The pressure remaining in your arteries during that resting phase is your diastolic pressure. That's the bottom number. For most of the 20th century, diastolic got most of the attention in medical research. And for younger patients, there was good reason for that. But here's where it gets interesting, and this is the part most people never hear explained clearly. As you get older, your arteries, especially the large ones near your heart, begin to stiffen. Not because of a disease necessarily, just because of time. And yes, accelerated by things like salt intake, inactivity, and years of untreated pressure. But some of it is simply the aging process itself. Think about a garden hose. A brand new hose is soft and pliable. Step on it and it gives a little. Squeeze it and it bounces back. Now think about that same hose after 10 summers baking in the sun. It's stiff. It cracks if you bend it too far. It doesn't absorb pressure anymore. It just transmits it. That's what's happening inside your arteries as you age. And when a stiff artery receives that same forceful wave of blood your heart sends out with every beat, there's nowhere for the pressure to go. It doesn't stretch and absorb the impact the way a young artery would. bounces the pressure right back. The result? Your systolic number, that top number, starts climbing. Meanwhile, your diastolic number often stays the same, or in some people actually starts dropping. So you get this exact scenario I described earlier, 146 over 88, or maybe 152 over 76. High top number, acceptable bottom number. And here's the mistake almost everyone makes. They see that normal-looking bottom number and relax. But ask yourself something honestly right now. When's the last time you actually looked at your top number, separate from the bottom one, and asked whether it was where it needs to be? This specific pattern, high systolic, normal, or low diastolic, has an actual medical name: isolated systolic hypertension. And I want you to remember that phrase, because if you're over 55, there's a real chance this describes you right now, even if no one has ever said it to you directly. Here's what makes this pattern so dangerous. It doesn't feel like anything. There's no headache that shows up reliably, no dizziness, no chest tightness that sends you to urgent care. Most people walking around with isolated systolic hypertension feel completely normal. They go to work, they play golf, they pick up their grandkids. Nothing on the outside tells them anything is wrong. Which means the only way to know is to actually look at the number. Not guess, not go by how you feel. Look. And the research on this is not subtle. Large population studies tracking cardiovascular risk have consistently found that after age 50, systolic pressure becomes a far stronger predictor of stroke and heart attack than diastolic pressure. In some of these studies, every increase of about 10 points in systolic pressure above the healthy range was associated with a meaningfully higher risk of a cardiovascular event over the following years. Let that sink in for a second. 10 points. If your systolic is sitting at 160 and you're comparing yourself to someone at 140, that's not a small gap. That's a real difference in how hard your arteries and your heart are working every single hour of every single day for years without you feeling a thing. Most people never realize this part. The danger isn't the number itself in any single moment, it's the repetition. It's that surge happening 60, 70, 80 times a minute, every minute for years on end. One high reading isn't going to hurt you. Thousands of high readings a day, sustained over a decade, absolutely can. Now, before I tell you what to do about this, you need to understand where this pressure actually goes, because this is the part that changes how seriously people take it. Your brain. Your brain runs on an incredibly delicate network of small blood vessels, some barely wider than a hair. Every surge of high systolic pressure sends a small mechanical jolt through those vessels. Occasionally, that's nothing. Repeated for years, those tiny vessels can narrow, stiffen, or in some cases, tear. Small patches of brain tissue lose blood supply here and there, quietly, without symptoms. And this kind of slow, accumulated vascular damage is one of the lesser-known contributors to memory decline and cognitive changes later in life. Not every case of memory loss is caused by this, but a meaningful portion of it is, and that portion is largely preventable. Your heart. When your heart has to push against consistently high resistance, the main pumping chamber, the left ventricle, starts to thicken, the same way any muscle thickens when it's overworked. That might sound like it's getting stronger. It isn't. A thickened heart wall actually becomes stiffer and less efficient, and over years, this is one of the most common pathways toward heart failure in older adults. Your eyes. The blood vessels lining your retina are some of the smallest and most delicate in your entire body, and they are not spared either. Brain, heart, kidneys, eyes. 4 different organs, one shared cause. That's why I don't think of high systolic pressure as a heart problem. I think of it as a whole body problem that happens to show up first on a blood pressure cuff. Here's a question worth sitting with for a moment. How long has your systolic number actually been elevated? A year? 5 years? Longer? Because none of this damage happens overnight. It happens in silence, slowly, while everything on the surface looks completely fine. I want to be honest with you, not dramatic. If you let elevated systolic pressure go unmanaged for years, you are meaningfully raising your risk of a stroke, a heart attack, heart failure, kidney decline, and vision loss, not as some distant hypothetical, but as a documented statistical reality backed by decades of research. But here's the part I really want you to hear. This isn't a countdown clock where something bad is guaranteed to happen by a certain date. It's closer to a slow accumulation of risk, like interest compounding in the wrong direction. Every year it goes unaddressed, the number tends to climb a little further, and the pressure on those 4 organs builds a little more. The good news, and there is genuinely good news here, is that this is one of the most reversible risk factors in all of medicine. Unlike a lot of things we deal with as we age, this one responds. It responds to lifestyle changes, and it responds to treatment when lifestyle alone isn't enough. You have far more control over this specific number than almost anything else affecting your long-term health. Let's get practical, because understanding the problem doesn't help you if you don't know what to actually do with that information. 1. Know your real number. Most people only get their blood pressure checked once or twice a year in a doctor's office under conditions that don't reflect real life. A basic upper arm home blood pressure monitor costs very little and takes 5 minutes to use. Sit quietly for 5 minutes first, then take 2 readings 1 minute apart in the morning and again in the evening. Write them down. That log, tracked over just 1 week, tells your doctor more than a single office visit ever could. 2. Cut back on sodium, specifically. As you age, your kidneys become less efficient at clearing sodium, which means the same amount of salt has a bigger effect on your pressure than it did at 30. The biggest sources usually aren't the salt shaker. They're bread, deli meat, canned soups, and restaurant food. Start reading labels this week, and you'll likely be surprised by where most of your sodium is actually coming from. 3. Move your body, especially aerobically. Regular activity like brisk walking, swimming, or cycling does something remarkable. It actually helps preserve the flexibility of your artery walls. Remember that stiff garden hose? Movement is one of the few things that slows that stiffening process. Even 30 minutes a day, 5 days a week, has been shown in research to meaningfully lower systolic pressure over time.
4. Watch your weight. Gently. You don't need a dramatic transformation. Even modest, sustainable weight loss, losing that stubborn 10 or 15 pounds, can measurably lower your systolic number. This isn't about appearance. It's mechanical. Less tissue for your heart to supply means less resistance for it to push against. 5. Manage stress deliberately. Chronic stress keeps your body producing hormones that elevate blood pressure day after day. Something as simple as 10 minutes of quiet breathing, a daily walk outside, or time spent on something you genuinely enjoy can measurably bring that number down over weeks and months. This one gets dismissed too easily. Take it seriously.
Now, I want to address a few things I hear constantly in my practice, because I know some of you are thinking them right now. I'm too old for this to make a difference. I understand why it feels that way, but it's simply not true. Research on blood pressure treatment in older adults has repeatedly shown that lowering systolic pressure reduces risk of stroke and heart attack even when treatment starts later in life. Your arteries respond to positive change at any age. It's genuinely not too late. It's too late. The damage is already done. Some structural changes in your arteries are permanent. That's true. But the trajectory going forward is not fixed. Lowering your pressure today reduces the ongoing daily wear on your brain, heart, kidneys, and eyes starting immediately. You're not undoing the past. You're protecting the years ahead. If I need medication, it means I failed. I want to push back on this directly because I hear it constantly, and it genuinely holds people back from protecting themselves. After a certain age, structural stiffening in your arteries is biology, not a personal failure. I have patients who eat well, exercise regularly, manage their stress, and still need medication to keep their systolic number where it needs to be. That's not a failure of willpower. That's their body responding to decades of biology, and medication is simply precision support for that. There is no shame in it. I've tried everything and nothing worked. If lifestyle changes alone haven't been enough, that's valuable information, not a dead end. It tells you and your doctor that it's time to have a real conversation about additional support, whether that's adjusting a current medication or starting one. The goal was never willpower alone. The goal is your number, by whatever combination of tools gets you there safely.
Let's bring this together into what I actually want you to remember. 1. After 50, your systolic number, the top one, is generally the stronger predictor of stroke and heart attack risk, not the bottom number. 2. A high top number with a normal bottom number is not reassuring. It has a name, isolated systolic hypertension, and it deserves your attention. 3. This pattern is caused by natural stiffening of your arteries over time, which changes how pressure moves through your body. 4. The damage from unmanaged systolic pressure builds silently over years in your brain, heart, kidneys, and eyes, often without any symptoms at all. 5. Lifestyle changes, sodium reduction, movement, weight, and stress management can meaningfully lower your systolic number, sometimes dramatically. 6. Medication, when needed, is not a personal failure. It's a legitimate, well-studied tool, and there's no shame in using it. 7. The single most useful thing you can do is simply start tracking your real number at home, consistently, starting this week.
I'd genuinely like to know, what's your systolic number running right now? And be honest, when's the last time you actually checked it at home, rather than just at a doctor's visit? Drop it in the comments below. You might be surprised how many people reading this are in exactly the same spot you are, and your comment might be the thing that pushes someone else to finally check theirs. If this video gave you something worth knowing, send it to someone over 50 who needs to hear it. A parent, a spouse, an older sibling. This is the kind of information that quietly changes outcomes, and a 2-minute share could matter more than you realize.
Here's one small thing to actually do this week. Check your blood pressure at home, morning and evening, for the next 7 days. Write each reading down. That's it. 7 days of data will tell you more about your real risk than a single number ever could. And if you want more videos like this one, clear, practical, no fluff breakdowns of the health decisions that actually matter after 50, hit subscribe. I put out new videos on exactly this kind of thing regularly, and I'd love to have you back.